Hamilton. He is also a Master's of Athletic Training student, second year, and just so I don't be repetitive, I think we have six more after this. So all second year Master's of Athletic Training students. Cole is going to do talk about competitive anxiety and risk for college athletes. So he'll talk about that. So Cole, I'm going to turn it over to you and let you go ahead.
All right, so thank you everyone. As Dr. Clark just said, my name is Cole Hamilton. I'm in the Masters of Athletic Training program here at JSU. So my topic is basically competitive anxiety and the correlation of that and basically injury risk for collegiate athletes. So just start out with the definition. What is competitive anxiety? Basically, it's when an athlete's self-esteem feels threatened and creates a negative feeling because competition is believed to be unattainable. Some words similar to that you've probably also heard. You can have trait anxiety, state anxiety, preseason anxiety. Those all kind of go together a little bit. And then just a little data. 2019, 34% of collegiate athletes experienced anxiety issues. And then 2023, among a group of athletic trainers surveyed, 85% reported anxiety issues among the athletes they were treating. So just give another definition. So basically the risk for injury, I'm sure it might sound kind of common sense. It's the risk for injury, but there is a definition for it, and that is the probability of an athlete being injured during a period of competition, practice, or any other specified time. 2017, 40 to 50% of athletes would suffer at least one injury. So these are basically some of the things that can increase anxiety for collegiate athletes. Things like going from high school to college, academics, sports responsibilities, practice, workouts, all that kind of stuff. It could be the first time away from home. It could be the first time having financial responsibilities. Possible loss of scholarship, and then of course the potential for injury. And just show how big of a population we're dealing with. This is in 2000, so the number's even higher now, but over 500,000 athletes did participate in NCAA athletics. So these are just some of the ways that competitive anxiety can affect performance. So you have cognitive, affective, somatic, and then motoric. So basically cognitive, that's more mental, like affecting their mental state. Affective, that's more emotional, so affecting their emotional state. Somatic, that's more internal body, so heart rate, breathing, that kind of stuff. And then motoric, that's more muscle and motor control, affecting those kind of things. So my clinical scenarios, basically, competitive anxiety can put collegiate athletes at risk for injury, of course. Barriers can interfere with collegiate athletes seeking treatment. And then also, because of the lack of recent research, more studies could be done to help collegiate athletes with anxiety symptoms. I'll focus clinical questions, so the group, collegiate athletes, intervention. So basically what we're looking at is competitive anxiety versus not showing any anxiety symptoms. And then that we're looking at is risk for injury. So what I used for my search, Support Discus, Medline, PubMed, and then also got articles from Google Scholar as well. Keywords, just things like athletes, collegiate anxiety, competitive, preseason, injury, incidents, and risk were some of the terms that I used when looking for my articles. Criteria, English, I wanted to be year 2000 to the present. I wanted to be collegiate athletes, and then also peer-reviewed studies. And then exclusion, I didn't want anything involving high school athletes or professional athletes. I wanted strictly looking at collegiate. Had 60 articles, and then basically from those, I got 4 main ones that I used in my study. Quality assessment of evidence. So basically these were all cohort studies. So they used the Strobe checklist. As you can see, pretty much most of these were fairly high for the Strobe checklist. So my first one looked at prevalence of anxiety in collegiate athletes. So basically, this was to determine the prevalence of anxiety among that population. Basically, it found that 21% athletes acknowledged that they had anxiety symptoms. It found that female athletes were more likely to be at risk, but it did not specify or go into why they're more at risk. So there's still more research that can be done on that. My second article was basically competitive anxiety and injury risk. This was kind of the main one. It was to determine anxiety influence on the risk for injury. And then basically this one, it had 276 athletes that recorded anxiety symptoms. Almost 600 injuries were recorded, and over half of them occurred among athletes who reported those anxiety symptoms. And then so there was a higher injury incidence rate compared to the group that did not have symptoms, and that was actually 38.9% versus 16.3% per 10,000 athletic events. A third article that I looked at was barriers to competitive anxiety treatment. So basically this looked at how to determine barriers that prevent athletes from seeking help for their anxiety. Basically found there's a lack of knowledge, there's a stigma, there's a lack of time, and then also confidentiality as well. And I also found that head coaches can be an issue. Basically their attitudes towards mental health, not taking it seriously for the athlete. And then showed approximately 1 in 5 student athletes experience some form of mental health issues, and then fewer than half of them actually seek help. And then influence of life stress and competitive anxiety on injury risk. So this was to determine the influence, like I said, of life stress and competitive anxiety on injury risk. Basically this found that competitive anxiety did not influence injury risk, but there's a caveat to it. This one had a much smaller sample size than the other ones we looked at. And then also the athletes on the pre-test that they gave them, they already had low competitive anxiety scores. So they didn't really show any signs of already having anxiety before the test. Clinical bottom line, competitive anxiety among collegiate athletes, there is a link to injury risk. Mental health screening questionnaires are good at identifying that risk, eliminating barriers to help them get the help that they need can also lead to reducing the injury risk. And then also there's just limited research for this from 2015 to now. So more research being done would also be helpful. Implications, basically us as athletic trainers must be able to evaluate athletes for mental health issues, utilize those questionnaires in our baseline screening. Some of those such as the sport competition anxiety test, sport anxiety scale, and then a couple of others. And then we also need to be able to understand what the barriers are for the students so that we can help them get the help they need. So future research, obviously more studies need to be done, especially among collegiate athletes. More research on whether male or females are more at risk and why. Basically studying on how athletes view competitive anxiety. Some athletes might view it as a positive, that it motivates them and helps them, but most of them don't. And then studying on head coaches' views and how we can help them kind of understand more, and so they can help their players as well, which would also go hand in hand with reducing the injury risk. There's my references. And then I just want to say thank you to the Student Symposium for allowing me to speak up here, friends, family, Dr. Clark, one of the professors, and my classmates.
Questions for our speaker?
I was going to ask very fascinating research. What's your next step in your master's study? Are you planning to follow this up with some research among JSU athletes, or?
I haven't thought about that, but that would be pretty neat. Yeah, I think that'd be a good idea. Yeah. Mm-hmm.
And I don't know if it's a comment or a question, is it safe to assume that those metrics that you were talking about using with athletes are not standard operating procedures at this point in time?
The questionnaires and yes, ma'am. yeah, they're not very widely used.
Right.
So I think implementing them more would be very beneficial.
Okay, thank you.
All right, let's thank our speakers.